slideshow will be posted on a website, Complementary Oncology, COZA. So if you want to take a look at that in detail, and the references will then be on that website as well. So again, thank you for coming. We're going to look at the issue of cancer, both cancer prevention and some evidence about looking at what works to treat cancer. Again, very briefly, in a very shallow way, because this is an enormously complex subject. Cancer is perhaps one of the most complicated conditions. For a cell to become cancerous requires many insults, many years of insults, not just a single incident, but sometimes up to 20 insults to a cell before it's transformed into a cancerous cell. And even then, its likelihood of actually becoming a tumor is actually very small. Tumors are collections of cancerous cells that grow. The interesting thing about cancer cells is that they're immortal. They grow, and they continue to grow at the expense of the host. So when we're looking at cancer, we're looking at a condition that has taken many years to develop, and cancer is generally a disease of the aged. It also has enormous emotional connotations. Susan Sontag, an American author, wrote a book in the 70s called Against Interpretation, where she pointed out how we have an emotional response to cancer. Cancer is a disease, but in my treatment of people and working with people with cancer, I find just an enormous degree of distress that is beyond the condition of cancer itself. So we have to look at not just the disease itself, not just at that aberrant cell, but we naturally need to look at the emotional, psychological, and social impact of cancer as well, because it's an important thing to look at. 40% of the people in this room will get cancer, statistically. And probably more because this is a more aged group. And as I said, cancer is a disease of age. You're more likely to get cancer when you get older. Likelihood when you're young is very small. Now, one of the things, this is a proviso. Cancer is not a disease to self-medicate. And this is one of the things that I come across all the time. Patients come to me and they've read something, they've gone to Google, they've gone this thing, I'm going to do this sort of thing. No. People often go and they go to a number of practitioners. They go to a homeopath, they go to a naturopath, they go to a herbalist, they go to an acupuncturist. And none of these people know what other practitioners are providing. And this is really unsafe, because we really need to share that. And they don't talk to their oncologist, and that's actually very dangerous as well. So it isn't something that has to be treated. You can't treat it yourself. You need to know what you're doing, and you need to let other people who may be working with you know what you're doing. Always go to the best expert. Go to several. Find out. Get real information. I had a patient recently communicate to me from America, and she was taking 50,000 IU of vitamin D3. And I said, are you getting your bloods done? You know, I mean, this is high dosage. If you're extremely deficient in D3, this may be a short-term measure. But I said, are you measuring your blood, to find out if this... She said, oh, no, the company didn't suggest that I do that. This is irresponsible. You need to look at, you need to examine. Anything that you're doing needs to be examined and tested. If someone suggests that they have a cure for cancer, run, because nobody has a cure for cancer. People go into remission, people are cured, but nobody has a pure protocol that says, I know how to cure cancer. If you would have the Nobel Prize. So there are ways and there are things that work, but there is no universal treatment. What seems to work, because it is such a complex thing, is a combination, and that's why we're looking at, in the last 15 years, the concept of integrative oncology has become more and more impactful, and particularly in the States, places like MD Anderson, Sloan Kettering, cancer councils are looking at the combination of orthodox oncology and complementary oncology, and this is really particularly effective, and it's driven by the consumer. It is driven by the patient who is saying, I want the best. And then these centers are finding people to work together. and it is based on evidence. You need to know that a herb that you're using or a compound you're using is going to, in fact, enhance the effect of chemotherapy rather than in some way harm the patient or aggravate the condition, undermine the treatment. Cancer is without a single cause. There is no diet, and again, this is the thing, people go on radical diets. If you like going on the Gerson diet, that's fine, but there's no evidence that a juice-based diet will treat cancer. There is, once cancer has been established, now, before you get cancer, diet is critically important, but there's no evidence. And again, it's really important. If you go to Google and you look at cancer, you will get about 300 million hits, more than you could look at in your lifetime. Most patients only go past the first page, and most of what's on the first page is rubbish. If you want to look at something to do with cancer, go to PubMed. Go to one of the peer-reviewed, even Google Scholar has peer-reviewed material. Go there and look at the information. You're going to find information that is then at least has some degree of responsibility. Cancer is preventable. 90% of cancer is avoidable. And it's amazing when you think about it. Cancer being... Statistically, cancer is not diminishing in occurrence. It perhaps is increasing, perhaps decreasing by a few percent. There are some reasons for that. Some of the reasons are people are living longer, and people who get older get more cancer than people who are younger, so that's one factor. Diagnosis, screening for cancer is being involved, so therefore more cancer is being diagnosed. So those are some of the reasons. But statistically, since 1975, cardiovascular diseases have decreased by about 40%. Cancer has not. So there is something that's going on around this area. So it is the reduction of exposure to well-known behavioral or environmental factors that really need to be looked at. So if you want to avoid cancer, you don't start doing it after you have cancer. You start doing it when you're 30 or 40. These are, this is from the National Center for Biotechnology. This looks at the 10% that is associated with genetic factors as opposed to the environmental factors. And again, that's a really interesting thing to look at. The causes, overweight and obesity. Visceral adiposity is not just inert fat. It is biologically active. It produces insulin-like growth factor. It produces hormones. It produces estrogens, for example. So don't have any weight that you didn't have when you were 21. You know, I mean, I'm 68. It's a struggle to keep the weight down as you get older, but you need to do that. So that's an issue. Low fruit and vegetable intake is also associated with that. High animal fat intake. Physical inactivity. All of the things that are associated with our modern lifestyle. In a few slides, we're going to look at some of the cancer statistics in South Africa. Alcohol, smoking, of course, unsafe sex, urban pollution, chemicals, food dyes, etc., etc. These are all factors associated with cancer causes. Lifestyle is responsible for up to 90% of the diseases. In the U.S., these various agencies estimate the number of cancer will increase still further because of the growth factors. And cancer is an expensive disease. Something like 90% of your medical costs you incur in your lifetime will happen in the last 6 months of your life. And cancer is the most expensive disease to treat. And this is one of the reasons why complementary medicine is an important adjunct or a contributor to integrative oncology, because it brings economy. Calorie restriction is an important contribution. We eat too much, and we don't exercise enough. Our ancestors in Africa spent 12, 14 hours a day moving, and ate a diet that was high in fiber, low in energy, low in